Hey everyone, I'm Dr. Josh Jagoda, and today I'm going to show you how to mobilize your SI joint. The SI joint is a collection of a couple areas of the body right in our hip and pelvis in the back. It can feel like low back pain, but it's really right at that bony aspect right here in the back of our pelvis. It's right where the ilium comes together and meets the sacrum and creates this SI joint. And so this is a great little mobilization you can do. So what you'll do is you'll get into like this spinal twisting pose, but you have to keep in mind that this is a spinal twist right here, right? So if you're overly rotating this way, you're going to get a lot of torsion and tension into the spine, and you might get an adjustment or a pop or a click there, but that's not what you're looking for. Even though that will possibly help with the actual alleviation of discomfort or pain, it's not going to actually serve you because you're not isolating the right joint if you have a true SI problem. So what you want to do is take your hand and you want to point it down this way. So almost like your fingers are pointing down towards your legs or towards your butt, and then what you're going to do is kind of scoop it this way. So you're going to kind of scoop it towards the line of the femur. So you're going to start here and you're going to rotate it this way, just like that. And if you can't do that, it's okay. You can pull it this way, you can pull it this way. It's really up to you. And you missed it. I already got the adjustment actually right out of the SI joint. So I actually came this way. And what you want to do is the SI joint is actually in about 30 degrees this way. So you want to go along that direction. If it's 30 degrees, you want to go in that plane. You don't want to go this way. You don't want to go that way. If you go too much this way, like I said, you'll get spine. If you go this way, you're really not going to get much. So you're going to have your hands pointing down this way, but your force is actually going to go towards that actual femur. Now, I say towards the femur right now, but if your leg is at 90, well, that's 90 degrees. So you want to make sure that it's about 30 degrees this way. So if you see my hip in this way, I'm going to show you it's about 30 degrees. And I'm going to flex this to a little bit more than 30 degrees, but my angle is going to be that I'm pushing like this. And it's going to come like that. And I can actually feel it. And you're going to push in and pull out. Push in and relax. Push in and relax. And it's really crazy because you actually feel the SI joint gap and come back. And the other side, I actually had an adjustment out of that. And you're coming over. And if you want to give yourself a little bit more traction, take your thigh and pull it down this way. I actually just got another release as I did that. So just like that, and come in. And I'll just show you on the other side again. So just like this, and you're gonna come in and drop this. So again, I'm pushing that way. Looks like my hands are pointing downward and scooping. They are downward, but they're also torsioning this way. So here. And if you notice, my arm and my shoulder is not dropped this way because that's more of a spinal twist. So I'm up, relaxing like that. And that's how to mobilize your SI joint. It's really highly effective. If you just noticed, I don't know if you heard, but I was able to get an adjustment actually out of both sides. So if you're somebody who's suffering from SI joint pain, sacroiliac joint pain, this is going to really help you. Again, you gotta mobilize it, keep it comfortable. Don't try forcing anything, because if you do that and it's already irritated, I've seen flare-ups in the past. You don't want to do that. It's better to go less now, mobilize it, and if you need to go back and do it again, you can always do it again. But if you do too much, then you can't undo that. So keep that in mind with this mobilization. All right, guys, I'm Dr. Josh Jagoda. Thanks for stopping by, and don't forget to subscribe to our channel. We'll see you guys for the next episode. Bye.